My name is Paul Martin-Paddle. I'm an ear, nose and throat surgeon with fellowship training in Laryngology, voice, airway and swallow. My current academic position is as Clinical Associate Professor at Sturt University and Senior Lecturer at Monash Health and Monash University. I studied medicine at the University of Melbourne and completed that in 2003. I went on to complete my surgical fellowship through the Royal Australasian College of Surgeons. I undertook advanced training in Otolaryngology here in Australia and then undertook a post-fellowship position at Harvard University in Laryngology and then returned to Melbourne for further work. Along the way, I also undertook other additional degrees. I undertook a Master's in Public Health here through Melbourne University, a postgraduate diploma in anatomy also through Melbourne University. It would go without saying, probably to say to all academics and anyone who's undertaken tertiary education, that being at university was a key turning point for me in my career, where you finally got to explore what truly motivates you, both academically, but also in an extracurricular way. You get to meet people who have a similar zeal for what you do, and you really get an opportunity to throw yourself deep into learning, deep into the educational experience. And so that jettisoned me upwards towards a career in surgery and in academia. Another key turning point for me, this was when I was already cemented in surgical training, was when I undertook my Masters of Public Health. For me, I had the epiphany that whilst as a surgeon and a clinician, I can treat the people immediately in front of me, and if I'm lucky, their loved ones indirectly and other family members. But through public health, executed well and researched well, I had the potential to positively impact many other lives in my community, in the region, perhaps ambitiously even nationally. So for me, the MPH provided me that lens through which I could see the various interventions, the various determinants of health that are not necessarily related to a scalpel. Another career turning point for me was the Melbourne Accelerator program that we were lucky enough to be admitted to along with my co-collaborators early on my return from fellowship. And what this was a startup grant, an incubator in which about 10 other startups received a stipend and worked in a collaborative workspace over a year to produce a nascent product or develop a nascent idea. And it's here that I saw that interplay of enterprise and business, but also technology and health in our case, and how important it was to have those conversations and to make those connections outside of our own siloed medical existence. I think this was also echoed by my time when I was at Harvard in a fellowship. And of course, there's the academic grandeur of a place so storied as that. But for me, the real turning point was, again, that realization of how fruitful conversations can be with groups outside of your own specialty, first of all. So the best ideas that my preceptor there, my mentor there had discovered is when they had conversations with other specialties, such as dermatology or pain medicine or respiratory, even though we were focused on the ear, nose and throat. And secondly, the fruitful conversations that you can have by talking to, in this case, it was various scientists and technologists at MIT. And so collaboration outside of my world of understanding was, and the realization of the fruit that could bear was a key turning point for me. And so coming back to Melbourne, coming back to my work here, I kept those things close to heart. The idea of saying yes to those conversations that are outside of my area of expertise, the idea of collaborating, and also the idea that perhaps through these collaborations we could create something that is more than just the patient right in front of me. Broadly speaking, my areas of interest include pediatric sleep and pediatric sleep ENT related disorders, and that is both on more than just the technical aspects of treating that, but again, more of a public health approach to that research. Secondly, and very closely related, is regional and rural healthcare, especially regional and rural ENT care, and how we can create greater equality of access and care throughout our regions as well as our city centres. Thirdly, my subspecialty area of interest is laryngology, and this is perhaps where my research is a little bit more science-based and more pure, and this is very much focused on voice, airway and swallow innovation. And then fourthly, as I mentioned in terms of other key areas of endeavour, I'm very heavily involved in a number of health tech startups, and so the burgeoning use of artificial intelligence, which is going to change all of our lives dramatically, and especially in healthcare, is another area of active research in terms of large language models and how we can utilize those and leverage those to help us document our patient interactions and conversations, and how we can further enhance our care. There's an adage in surgery that the enemy of good is better. And the reason we say that is because when we have achieved something that's good enough, surgically and technically, if we risk trying to reach for the stars or aim for a better result, we'll often increase the risk of complication. And so we usually, in a way, settle what is good enough if it's safe enough. And whilst that's reasonable, I'm driven by a passion to try and see what is better and how I can improve what I do. And whilst that may be a cliche in many respects, we all want to evolve and be better clinicians, surgeons, researchers, etc. I think it is important that we look for better solutions and never rest on the status quo. So I'm passionate about evolving and changing, and I'll be very disappointed if in 10 years I'm doing the same things the same way as I'm doing today. So that would be the number one passion that drives me. Another thing that I would certainly say drives me is that idea of saying yes to conversations. So no matter how time poor we are, no matter how fulfilled or involved in what we're doing, I make it I make it axiomatic that I say yes to conversations, whether it's from an industry representative, whether it's from another colleague, whether it's from someone marketing. There's always something that can be learnt from these interactions. So I'm driven by learning new things in areas I know nothing about, because one day I'm sure I'll be able to utilize them somewhere in my clinical care. I need to exercise the other side of my brain. And so for me, culture in terms of music, playing, although mostly now I don't play for myself, I play with my children when they're doing their practice, and so they may not see it as passionately as I do, but certainly music and maintenance of language and my own heritage and cultures and language are important to keep me sane. Health and fitness, of course, so that again I can be around a long time for my own children, but also do the work I do is a key driver. And of course family. Cliche as it is, our children motivate us. We see our own immortality and future in them, and I want to make sure they have better opportunities and come out as better humans than I am. So being there for them and giving them my time is a key outside of work driver.